Hello everyone, today we are going to discuss four common drugs which we are using in the obstetrics. The first one, that is injection syntocinon or pitocin. Pharmacological name is oxytocin, drug class is oxytocic. So those 5 international unit per ml, road IV or IM, frequency before and after the birth of the baby, mode of action. Oxytocin acts on the calcium channel to initiate myometrial contraction. It also stimulates prostaglandin products. So oxytocin acts on the myometrium layer, which is the middle layer of the uterus, and it produce contraction, and it can also stimulate prostaglandin production. Indication: it is the, it is different in every stages. In early pregnancy, to accelerate abortion, that means to speeding up the labor, speeding up the abortion, then to stop bleeding. In late pregnancy, to induce labor, to ripen cervix before induction. So to opening the cervix before induction, we are using in late pregnancy. In late in the labor, obstetric augmentation of labor. Augmentation means to stimulate the uterus in order to increase the frequency, duration, or intensity of contraction. Then uterine inertia, where the uterus do not contract in normal length, the normal strength. Then inactive management of third stage of labor and after expulsion of placenta. And in during the puerperium, to minimize the blood loss and to control the postpartum hemorrhage. And in contraindication, that is in pregnancy cases, in pregnant women, in some pregnant women we cannot give this medication. Under that, the grand multiple are those pregnant women who already have 5 fetus completed given birth to a fetus after 20 weeks of gestation. Next, contracted pelvis, then history of cesarean section or hysterectomy if the mother has done previously cesarean section or hysterectomy, then malpresentation. And in case of the labor, if the mother is in the obstetric labor or in the fetal distress means the mother fetus is struggling for breath, and incoordinate uterine contraction. And the condition where the uterine contraction is not in the coordinate poor condition, then in any time that in hypovolemic state, and in the mother is suffering from cardiac disease. And side effect we can see in the maternal, uh, after administering this medication, the uterus may be hyperstimulation, and then water intoxication and hypotension, antidiuresis. In fetal can have fetal distress. And nursing responsibility. So while giving this medication, we have to monitor the flow of oxytocin infusion, then recording uterine contraction per 110 minutes, monitor fetal heart rate in every 15-minute interval, then monitor vital sign of the mother, assess the progress of labor through observing rate of cervical dilatation and descent of the head, then monitor input and output chart, and stop the infusion in case of hyperstimulation of the uterus. While in study, if we have found the uterus is stimulated uh, more than a normal, then we have to stop immediately. The second medicine, that is injection methargine. So pharmacological name is methyl ergonovine. Drug class is ergo derivatives. Dose 0.2 mg, road IM or IV. Frequency late second stage of labor or following the delivery of the baby. So normally we should not give this methargine for induction purpose, and then before delivery of the baby. And then a mode of action, ergonomine directly acts on the myometrium. It produces uterine contraction so frequently. Same like oxytocin, methargine also produce contraction in the myometrium layer of the uterus. and but the uterine contraction is so frequently, so the relaxation period is less. Then indication prophylactic uh, for active enhancement of third stage of labor in therapeutic to stop atonic uterine bleeding following delivery, abortion, or expulsion of hydrated or more. So, in case during the abortion or expulsion of hydrated or more, after that, if the uterus is unable to contract, and so it can cause bleeding, so that is called atonic uterine bleeding. Then contraindication in prophylactic case, so we should not give the medicine to the suspected pleural pregnancy. Then if the mother is having a pleural effusion problem, then organic cardiac disease, severe preeclampsia and eclampsia, RS negative mother. And in therapeutic cases, if the mother is having the disease like heart disease and severe hypertensive disease. Side effect: who is taking this medication can have nausea, vomiting, hypertension, bronchospasm, gangrene of toes, lower prolactin level. So nursing responsibility, we have to monitor the vital sign of the mother. As is the sign of hemorrhage, hemorrhage means the bleeding, then administer the drug in deep muscle. If we give through IM, we have to give in a deep muscle. Educate the woman to report any sign of symptom and blood loss. We have to educate the mother, so if she has found that the blood bleeding is heavy, then heavy bleeding, so she has to inform to the nurse. Then insufficient drinks insufficient amount of water to avoid sweating and headache. The third one, that is injection prostin. Pharmacological name is prostaglandin. Drug class is prostaglandin. Dose 1 mg per ml. So if we give through IV route, then 600 mg if we give through per rectal, 3 mg per vagina. Frequency following delivery or abortion. So mode of action: prostaglandin are autocrine hormone as they act locally on their side of the production. Autocrine means the prostaglandin they are act on the same cell where they produce. Then the prostaglandin promote biometric contraction aspect of the testosterone. Same the other two drugs, they are also act on the myometrium, which is the middle layer of the uterus, so irrespective of gestational age. Indication in the induction of abortion. So normally we are choosing this medicine for the induction of abortion. Then termination of molar pregnancy, the induction of labor where the oxytocin is not able to is not we cannot use oxygen as a for induction of labor. Then cervical ripening prior to the induction of labor, augmentation of labor, atonic uterus, which we have already discussed that the uterus is not unable to contract in the normal uh, unable to contract. Then tubal ectopic pregnancy. The tubal ectopic pregnancy, if the pregnancy occur in the fallopian tube, that is called tubal ectopic pregnancy. Contraindication: hypersensitivity, uterine scar, previous cesarean section delivery, active cardiac, pulmonary, renal or hepatic disease, hypotension and bronchial asthma. Side effect: we can see the blurred vision, abdominal cramp, high headache and hyperstimulation of uterus. Nursing responsibility: we have to monitor the vitals of the mother, assess vaginal discharge following administration of the drug, assess the length and duration of the contraction after administration. So while after giving this medication, we have to observe for the duration and length of the contraction after 10 minutes. Then educate the woman to remain in the supervision of the administration of drug. So after giving this medication, the mother or the pregnant woman should be in the supine remain in the supine position. So it can otherwise it can cause the uh, uh, dizziness. Then the medicine has to store in the refrigerator at 2 to 8 degrees centigrade Celsius to maintain its potency. The fourth one, that is the magnesium sulfate. Pharmacological name also magnesium sulfate. Drug class anticonvulsant. Loading dose 4 gram IV over 3 to 5 minutes, followed by 10 gram deep in IM in 5 gram in each buttock, and maintaining dose is 5 gram IM. Maintaining dose that is the next dose which are going to maintain is 5 gram IM. Road IV or IM frequency following delivery of the baby. So mode of action, it causes vasodilation and increase cerebral, uterine and renal blood flow. It also blocks the calcium channel which reduce convulsions. Mainly magnesium sulfate, it can cause dilation of the vessels and increase the blood flow in the cerebral and uterine and even in the renal part, and it can block the calcium channel which reduce the convulsion. Then indication, preeclampsia and eclampsia. Preeclampsia is the high risk disease where the mother can have hypertension, then edema and proteinuria. And eclampsia, along these three symptoms with convulsion. Some contraindication, we should not give to the myasthenia gravis patient, carcinoma, severe renal impairment, dyselectrolytemia. Side effect you can see in the mother, flushing syndrome. So sudden sudden reddening of the face, neck, and upper chest due to the increase of blood flow. Then muscle weakness, pulmonary edema. Then in neonatal hypotonia, that is a muscle decrease the muscle tone. Then lethargy, the baby is less active. Respiratory depression. In nursing responsibility, we have to monitor the vitals of the mother every 10 minutes and assess if there is any convulsion of the mother. So after giving this and after administering the medication, if still mother is having convulsion, we have to assess that one. Then stay with the mother while convulsion. If the convulsion is occurred, then we have to stay with the mother, so to prevent from the falling from the bed and all. Then the monitor flow of the infusion, then monitor input and output. That's all.